Okay, so for this video, I'm just going to kind of show you visually how to use a gua sha tool. So essentially, this is IASTM, so instrument-assisted soft tissue massaging. Really great way to break up fibrotic tissue, kind of increased tissue extensibility. Really great to use it at the beginning of a therapy session, especially after heat. You'll find that a lot of your patients will genuinely enjoy this part as it feels kind of like a massage or a bit of a spa day, but it really just kind of gets the targeted tissue a little bit more flexible, a little bit softer. You'll find that when you are finding an area post-injury or maybe potentially through overuse, that you'll feel what we like to call fibrotic tissue. And so what essentially that is, so let's say, for example, let's say our client here had carpal tunnel syndrome, or had like wrist overuse here. So I believe we might find some stuff here. She's been climbing a lot, so we'll find like fibrotic tissue within like the area of overuse or where they performed perhaps potentially a surgery. But what that is essentially tissue kind of sticking next to each other, and so it's kind of our job to kind of break that up so that we can allow for more movement. But first and foremost, you'll want to add some sort of lubricant. I've seen multiple different uses. So some people like to use the ultrasound gel just because it doesn't really have a smell. It's water-based. Other people like to use like different types of like lotions or scented lotions. My favorite was probably one of the, what was it? I think it was like an aloe butter. It just smelled very, very good. But that's kind of something you ask your patients to begin with to make sure that they don't have any allergies to what you might be applying. Kind of give them the choice. Some people might like the scented stuff. Some people prefer the ultrasound gel. In some instances, these are even like heated in like a little unit. Some people might like the warmth from the warm ultrasound gel. But essentially, you apply some lubricant, find the area where you want to massage. This is the gua sha tool. You can use different parts of this. Essentially, it's just kind of like a smooth, rounded surface. It can be plastic, it could be jade, ranges in materials, but you can use like different nooks and crannies. Like for example, if I was focusing on a finger, I could take this little nook right here and get it really good on the finger. But in this instance, since we're kind of applying it to a large area, I'm just going to use the long side. And so I'll kind of just spread it. And yeah, so as I expected, so she's been rock climbing a lot, and so I can feel the fibrotic tissue here in this area because of her overuse of the wrist flexors recently. And so essentially, like I mentioned, it's just kind of like tissue, muscle tissue, and this tendon's just kind of getting stuck to each other. This is going to feel really nice later for her. You're going to see the redness. That's a good sign, but you also don't want to cause them any pain. So while I show you this video, it's really useful for you to see. At the end of the day, practicing on another individual, yourself, your professor, will be the best way to do it, or your clinical educator. But essentially, there's no really right or wrong way to go about it. I just kind of like look for where it's more fibrotic and then just start digging in there and going with the grain, against the grain. But right here, I can really feel it. Some people will describe it as like a kind of like a gravelly feeling. Feels like there's like a pocket of gravel under there and you're kind of just spreading it out. I'll usually do this for about like 2 to 5 minutes depending on how bad it is. But once it starts getting like really bright red, that's kind of my cue to stop. But here in this instance, you'll just typically ask your patient if it's hurting at all. So are you feeling any pain with this?
A little bit.
A little bit. So you can go a little softer. It won't be the most pleasant thing in the world, especially with individuals perhaps after like distal radius fracture. You'll find that it's very gravelly and they'll be very sensitive to it. They'll feel very tender, and so you'll kind of have to go lighter, but you'll still feel the graveliness from it. And eventually with time, you'll be able to work into a little bit higher pressure. But at the end of the day, you don't want to exceed a pain of 4 out of 10. But this is just sort of an example. You can do this just about almost anywhere in the upper extremity with like lat epi, dequer veins, trigger finger, stuff like that. You can kind of just get into each individual areas and use different tools. So this is like kind of something I would use for a larger like part of the body, so like the wrist. But they also make these little clay tools. I don't have one to show, unfortunately, but it's those little tools that they use to like carve out clay when they're on the wheel. And so it's kind of like a tiny little ring, and they're really great for using it on like the fingers. But just kind of a short little example of how to use a gua sha tool in IASTM, so instrument assisted soft tissue massage. And you can even do the similar thing with just your hand. You can do cross friction massaging in different areas in the body, but there's a lot of literature that states that this is honestly better for us. It saves your own hand as a clinician, so it just makes it a little bit easier for you, wears out your fingers and your wrists a little bit less. But yeah, that's that little crash course for that.